Hello, I am Dr. Deepti Rodrigues. I'm a consultant child and adolescent psychiatrist. I work with young children from the ages from 6 up to the age of 18. I specialize in diagnosing, treating, and managing mental health disorders. So, how it works, I conduct a very thorough assessment to understand the young person's needs, emotional, behavioral, and developmental challenges are taken into consideration along with their collateral from family, social, and school environment. So, based on this comprehensive assessment and evaluation, I also oversee all treatment plan, which includes medication, possible referrals to psychotherapy, or other therapeutic interventions. I do provide guidance for families and caregivers to the young people so that it creates a very supportive environment that promotes the child and adolescent's recovery and overall well-being. So my education began with, I got my Bachelor of Science degree from University of Radford in America, Virginia. I completed my medical degree in Hungary in the University of Debrecen Medical Science Health Centre. Then I moved to Ireland where I completed my basic specialist training in psychiatry and my higher specialist training in child and adolescent psychiatry. I am very proud to say that I'm also dual trained and received a fellowship training in intellectual disabilities. So I have over close to 9 years of clinical experience working with various community CAMS teams. I've worked in adolescent inpatient units. I've worked with liaison services, addiction services. Most importantly, my niche would be ADHD. I was the first clinician to be involved with the first community Admire ADHD services that just started in Dublin 5 years ago. So all this experience has really enabled me to refine my skills and to work towards very comprehensive neurodevelopmental assessment. I always work collaboratively within the teams to make sure that, I foster an environment that supports the child, the family together. I work with a lot of families at the moment and I hope to provide evidence-based kind of practice in my methods of delivering treatment with a lot of compassion. My main focus would be to get to know the child or the adolescent, right? So I want to gain understanding of their current difficulties. So that would mean I conduct a comprehensive assessment that usually involves talking to the young person directly on their own. And they could be talking about their feelings, their thoughts, the challenges that they're facing. But also, as part of the assessment, I do get a lot of information from the family. And as that's very important in terms of the developmental history, medical background, family environment, up-to-date school performance, and their current social peer interactions. So additionally, I also explore past mental health history, any medical history treatments, previous engagement with other services. So during the session, I observe the child and the young adolescent behavior, their emotional state, and sometimes I might use rating scales or standardized tests to clarify their symptoms. So after that, my initial impression is discussed with potential treatment options, which could include either therapy, medication, or referrals to other professionals. So in the first instance, I might recommend psychotherapy, which is often delivered by various therapists. However, if the clinical symptoms are moderate to severe, therapy alone isn't enough. I might consider psychopharmacological interventions. I also might suggest parent support, such as parent training or other behavioral interventions. That's just to help create a very supportive environment for the child's progress. I have a niche expertise in managing and treating ADHD. This is supported by my extensive clinical experience in this area. I work with children experiencing comorbid other mental health disorders, such as mood and anxiety. Additionally, my work previously with intellectual disability kids also has enabled me to refine further my skills in kind of delivering a very comprehensive neurodevelopmental assessment, diagnosis, and treatment. And so I tailor every assessment and treatment plan to the child's very unique developmental stage, the family context. I offer treatment options I try to work collaboratively with both the young person and the family to develop a plan which really best suits their needs for the present. If the medication management is required, I always follow up to date evidence based guidelines. I have expertise in diagnosing and managing very complex and comorbid mental health conditions. So, my main focus is really ensuring that the families and young people are fully engaged in the treatment care plan, as I believe the collaboration is the key to achieving a very successful recovery for them. Mental health difficulties among children and adolescents in Ireland are a significant concern with the growing prevalence. And over the last years, I think the impact of COVID-19 has really exacerbated mental health issues among young people, specifically conditions like ADHD, which have risen from 7% to nearly 20% in this population. To some degree, I think everyone is vulnerable to mental health difficulties. It can affect anybody, regardless of age. So I think it's important. Mental health is important, just as important as physical health for overall quality of life. Prioritizing it is really the essential piece. If there are any mental health concerns, I am very much happy to work with your child so we can achieve the best quality of life.